Cardiac Surgery Healthcare Professionals' Engagement in Research at the Bedside, Challenges and Opportunities by Suzanne Fredericks. The increased emphasis on evidence-based practice in healthcare has led to a move of hospital-based nurse education into higher education institutions. There is a need for a significant shift in focus on educational training from imparting research contents to providing opportunities to experience the research process. Research was introduced in the nursing curriculum to increase awareness of research and capacity building to promote research output. Such strong emphasis on teaching and developing research in nursing programs was at both the undergraduate and postgraduate levels and is evident in many parts of the world. Within clinical practice, nurses' input in generating research evidence has also been encouraged by the introduction of advanced practice nurse practitioner roles. Despite these efforts to increase opportunities for research participation, there has been a general lack of research to guide practice. Nurses' positive attitudes towards research are discordant with their actual involvement in research activities. So although the respondents of various studies have demonstrated a positive attitude towards research, they also have an overall negative perception of the research environment. Specifically, in Western countries, there is an insufficient research dissemination that's been reported, whereas in Eastern countries, there are complex organizational issues which contribute to skill deficits in interpreting and analyzing research. Many studies have identified research participation and use among nurses having been observed to be very low. The general perception of barriers which attributed to this was related to administrative issues, such as the lack of funding and protected time for research. Organizational support in terms of protected time and financial support need to be in place for nursing research experience. Research findings also demonstrated that in places where organizational support was available, awareness of research opportunities such as educational and organizational support needed to be strengthened. This in turn would enable more nurses, particularly those who provide direct patient care, to conduct research within the context of the competing nursing practice demands. Organizational support to use research and support from others to use research is needed. The most important factor is perceived to be organizational support, particularly in relation to providing time to use and conduct research. Strategies to support engagement in research in clinical settings. There are a number of strategies organizations can use to support the engagement in research within practice. The first of these being mentorship. The mentorship of nurse researchers as well as hospital-sponsored support to successfully bridge the gap between practice and research participation. Nurse researchers should be identified, encouraged, nurtured, and supported to be hospital-based scientists in their area of clinical expertise. As well, another strategy involves the collaboration between researchers, academics, and clinicians. These individuals should work jointly together towards promoting nursing research in practice. There should be facilitation, support, and encouragement, as well as role modeling of the application of evidence within practice. A third strategy involves increased communication, as well as an increased awareness of the various sources of support for research within organizations. As well, overall positive attitude towards the engagement in research needs to be present within organizations. Finally, securing time for staff to undertake small projects and then to disseminate the findings to their peers. A specific example in which many of the strategies that we just talked about have been implemented within the clinical setting is presented in the study by Burns and Ferguson-Paré. The authors, they describe a study that evaluated the implementation of a professional development model in which nurses spent 80% of their salary time in direct patient care, and the remaining 20% of their salary time was spent on professional development. The professional development time included focused learning about patient-centered practice guided by the human becoming nursing theory, a qualitative descriptive pre-project process and post-project method, as well as a longitudinal repeated measures descriptive comparative method were used to answer the various research questions. Participants were 33 nurses, 11 other nurse leaders and health professionals, and 55 patient and family members. The findings indicated that on the study unit, overtime hours decreased significantly. The education hours were sustained throughout the study period. Workload hours per patient day increased significantly. Sick time stayed low. Patient satisfaction scores increased. Staff satisfaction scores were significantly higher. And turnover was non-existent among study participants. This specific study with the 80-20 model, where you have 80% of a nurse's time is spent within clinical practice, 20% within professional development. The 20%, the professional development time itself, was related to engagement in either reading research studies, working on research grant proposals, or disseminating research findings, as well as there were some participants were involved in the actual conduct of research. Having protected time with this specific study is demonstrating that if there is that protected time built into nurses' schedule, where as part of their usual work hours, there is a lot of time for them to spend in the engagement and research, we're seeing significant patient outcomes, where we're seeing patient satisfaction scores, as I had mentioned before, increase. We're also seeing the nurse themselves, their turnover rates are low, their sick time rates are low, workload hours per day, they increase significantly in that the productivity of the workload increased significantly. So we're seeing that there, and also, which was also important, the turnover is non-existent among study participants. This is one study where it's demonstrating that the engagement in research does have some significant benefit. However, this is just one example, and there's very few. This phenomenon of nurses engaging in research at the bedside needs to be continued to be evaluated over time. So it is evident that we do need there is extra work needed in this area. We do have one specific example where engagement in research at the bedside has been evaluated. There is a need for further exploration, but it does give us some indication there is a need for us to continue to look at different ways to promote research and the uptake and the engagement in research at the bedside. Thank you very much.